5 things you can do for your pelvic floor right after giving birth. Number 1, you can start contracting your pelvic floor muscles right away. You don't have to wait for your 6-week checkup to start working your pelvic floor muscles. Trying to slowly engage them after giving birth helps to bring blood flow to the area and helps the healing process. You don't want to be too aggressive, but you can start with recruiting those muscles and engaging those muscles again. Number 2, use cushions. If you have birth trauma, if you have stitches, you had a lot of tearing, you can use a donut cushion. This helps relieve pressure on the pelvic floor. Also, if you had pain in your tailbone after delivering, you can use a U-shaped cushion like this to relieve pressure on the tailbone. It's also a positional cushion because it's wedged, so it puts your pelvis in the proper position. Feel free to use cushions to help relieve the symptoms in your pelvic floor. You want to wait to your 6-week checkup. Actually, you want to wait even longer, like 2 months postpartum, to be really aggressive with your workouts. Remember, 2 months after giving birth, you still have pregnancy hormones coursing through your body. So they still have effects on your muscles and your joints and the laxity in those joints. So you want to still protect them at least 2 months after giving birth. So don't be too aggressive right away. Don't be hard on yourself. You just grew a human and passed that human through a tiny hole, whether the hole is in your pelvis or in your abdomen. It was a lot of work, so give yourself time to recover and recuperate. Do start working on scar tissue, whether the scar is from a C-section or from stitches in your pelvis. So you don't want to work directly on the scar. Wait about 2 weeks after giving birth and start mobilizing the tissue around the scar, about 2 inches around the scar. Just start moving in small circles, just get those layers of tissue and skin moving so everything doesn't get bound down. You don't want to have a sensitivity, a nerve sensitivity, skin sensitivity, because everything's getting bound down. You don't want to have restrictions in your movement. So starting the mobilization early but gently and not right on the scar is important. So try these 5 things after giving birth to get on the road to rehabbing your pelvic floor and your abdominals.